Hi, I'm Colleen Bamford, and welcome to Health Watch In Depth, presented by UMass Memorial Healthcare. On today's show, we're going to take a look at arthritis and joint replacement. In a few moments, we will be joined by experts from UMass Memorial in this field. But first, let me introduce you to a doctor turned patient.
Hi, I'm Dr. Deborah DeMarco, and I'm a rheumatologist at UMass. I had a knee replacement in 2009. I was a marathon runner for a number of years. I've exercised pretty much my whole life. 2005, I started to notice pain while I was running in my right knee. Of course, I ignored it, being a physician and being a rheumatologist. And then I started taking anti-inflammatories as needed, some Tylenol. But I reached a point where I continued to have pain and finally sought medical attention. I had my first knee arthroscopy at UMass Memorial in Marlborough, and it didn't really make much of a difference. I was still able to run, but it was becoming apparent that I was going to have to give up running at some point. In about 2008, I first saw Dr. Ayers. I never had a major injury to my knee, but I do have a family history of osteoarthritis in my mother and other family members. So I guess it wasn't such a big surprise. Had the knee replacement in January of 2009. I decided that I was going to behave and be a good patient rather than be a physician. My experience was really much smoother than I ever expected. When I was trying to decide where to have the surgery, I looked into Boston hospitals and area hospitals, but ultimately chose UMass because of the reputation of the surgeons, the nursing care, experience that my patients have had at UMass with good outcomes and good care there. And I didn't really see any reason to have to travel out of my own community to have the surgery. The nursing care was phenomenal. It was just, they were like angels. The physical therapy, as I tell patients, is really very, very difficult. At about 8 days, I started formal physical therapy at a physical therapy location. You go 3 times a week. You have to do a lot of it on your own at home, so it does. He kind of laughed at me when I asked him how soon I could go back to work, and he said, "Physical therapy is your job," and he's right. I had a great therapist who I worked with. I did whatever I was supposed to do at home and then some probably, and was driving in about 3.5 weeks, which is, I think, a little fast, but and then was back to work at about 7 weeks. I have no pain in the knee that was replaced. I sort of converted myself into a cyclist and do long distance century rides, which is 100 miles with no pain at all. And in fact, I put 3,600 miles on my bike last season. So I remember the first day I got on my bike after the surgery. I was nervous, of course, because anything I did after the surgery, I was nervous that I was going to harm the prosthesis. So one of my riding partners drove me up to a bike path. And we felt that was the safest place if I fell off the bike without, to be there without cars. And it was a great feeling to be able to get on the bike and get out again and do some of the things that I enjoy doing. Being able to walk my dog again, for a long distance. I'm asked all the time by patients as well as friends and friends of friends, when is the right time to have the surgery? And it's really a very personal decision. For me, I went from being able to run a marathon to not being able to walk my dog around the block without having pain. So I was young to have a knee replacement, and I might face having a revision because I was young, but to me, the lifestyle issue was the most important, and being able to do the things and the activities that I like to do. You worry about what type of outcome you're going to have, I think. Was I going to be able to do the things that I really wanted to do? And basically the only thing I can't do is run. So I would say I had an excellent outcome.